who will be thanking our representatives for their public option government-run insurance. First are Brenda and Jim on behalf of, well, they're Medicare recipients. And following that, we'll have some call to action, so stay tuned.
Good afternoon. I'm Brenda Lambert. This is my partner of 39 years, Jim Shea.
Welcome. Hey, glad to see everybody here. We are both recipients of 2 government-administered insurance programs, Medicare and Social Security, and we're mighty glad of it.
For the first couple of decades of my being an employed adult, I had no insurance. Fortunately, I had good health, so I managed to get by without it. During my middle years, I moved to Charlottesville and went to work for the University of Virginia and had what was thought of as good insurance provided by the university. At this point, I did, over the 20 years that I worked for the university, have some health challenges, so I use this insurance. Now I'm retired and I have Medicare. Of course, the best of these options is to have good health and not need insurance, but that's not true for many people for very long. I just want to say that unequivocally, Medicare is much, much better than the private insurance I had. In the private insurance, you have to see doctors within a small network in order to get the smallest copay. If you want to see somebody outside the network or need to, you pay 2 or 3 times as much. If you want to see a specialist or need to see a specialist, even if you know that's what you need, you have to be referred by your primary physician. What this means is 2 appointments, 2 payments. Many procedures have to have pre-approval to be covered from the insurance company. None of this is true with Medicare. I have never gone to a doctor who doesn't accept Medicare. I know there are some, but I've never needed to or gone to one who didn't take it. I've never needed pre-approval for any treatment that I got. If you think that I haven't been covered by Medicare long enough to make these judgments, let me tell you that my 91-year-old mother, who's had Medicare for a lot longer than I have, she's had several operations, she's had 2 pacemakers, she's had the regular health care that befits her age. She is also a very happy Medicare recipient.